In type 1 diabetes, the pancreas is unable to produce any insulin, the hormone that controls blood sugar levels. Insulin production becomes inadequate for the control of blood glucose levels due to the gradual destruction of beta cells in the pancreas. This destruction progresses without notice over time until the mass of these cells decreases to the extent that the amount of insulin produced is insufficient. Type 1 diabetes typically appears in childhood or adolescence, but its onset is also possible in adulthood. When it develops later in life, type 1 diabetes can be mistaken initially for type 2 diabetes. Correctly diagnosed, it is known as latent autoimmune diabetes of adulthood. Causes of type 1 diabetes. The gradual destruction of beta cells in the pancreas that eventually results in the onset of type 1 diabetes is the result of autoimmune destruction. The immune system turning against the body's own cells is possibly triggered by an environmental factor exposed to people who have a genetic susceptibility. Although the mechanisms of type 1 diabetes etiology are unclear, they are thought to involve the interaction of multiple factors. Susceptibility genes, some of which are carried by over 90% of patients with type 1 diabetes. Some populations, Scandinavians and Sardinians, for example, are more likely to have susceptibility genes. Autoantigens, proteins thought to be released or exposed during normal pancreas beta cell turnover or injury such as that caused by infection. The autoantigens activate an immune response resulting in beta cell destruction. Viruses, Coxsackie virus, rubella virus, cytomegalovirus, Epstein-Barr virus, and retroviruses are among those that have been linked to type 1 diabetes. Diet, infant exposure to dairy products, high nitrates in drinking water and low vitamin D intake have also been linked to the development of type 1 diabetes. Subscribe us to know more health tips and home remedies.